My name is Angie. This webinar is being moderated by Dr. Catherine Brookman, Associate Director for the Center of Research Expertise for the Prevention of Musculoskeletal Disorders. And now I'll hand it over to Catherine.
Thank you very much, Angie. On behalf of Dr. Jack Callahan, Director of the Center of Research Expertise for the Prevention of Musculoskeletal Disorders, or CREMSD as we are more commonly known, we'd like to thank WWDPI for allowing us to collaborate on this construction series with them. CREMSD would like our participants to know we are grateful to the Ministry of Labor for the funding that allows us to participate in these type of webinars. In terms of the format for today, as Angie mentioned, I will relay any questions that you have over to Kent, and then given the time we have, hopefully 10 to 15 minutes, we will respond, and if we're not able to get to all of your questions, we will certainly do that through the follow-up email. So thank you, and without further ado, it's my pleasure to introduce to you our speaker today, Dr. Kent Anger. Dr. Kent Anger has a PhD in experimental psychology from the University of Maine and served in the Public Health Service as a scientist director, neurobehavioral toxicology research section at NIOSH before joining Oregon Health and Science University as the Oregon Institute for Occupational Health Sciences Associate Director for Applied Research in 1989. He has been continuously funded and has over 90 peer-reviewed publications in behavioral neurotoxicology and total work health interventions. We look forward to hearing his presentation today on organizational and individual intervention methods that improve total worker health in construction workers. Over to you, Kent.
Okay, well, thank you very much, Catherine, for the nice introduction and for the invitation to be on the webinar today. You can see the title on the screen. You can also see the building that I'm in on the left-hand side of the screen, and you can see the tram that I might have taken to work this morning as I arrived at the university from the river at the bottom of the university. The funding for the project that I'm talking about is now on the screen from NIOSH, and all the research I'll talk about was approved by the University IRB, the Oregon Health and Science University IRB. I do have a conflict of interest in that I have licensed the training program that I'll be talking about from the university into a company that I formed as one way of disseminating the information out from it. Well, when NIOSH supports or develops ideas for new projects, they look at burden, need, and impact. And so I'm going to talk about burden and need a little bit at first, because that's kind of background to the overall project. And the data that I'll talk about come from CPWR, and they're data from the United States, not from Canada. But I figure there's a high correlation between what's happening in the United States and in Canada with respect to workplace activities. So here's Casey. Casey was a drywall finisher in Oregon, near where I work. And one day he was working in his area and he jumped on his stilts, which he did to apply drywall compound, and he fell off of them. And he essentially became paralyzed from his waist down. This is the kind of accident that kind of brings home to us the human picture of what happens in these accidents and illnesses that happen in the construction industry. And in terms of non-fatal injuries, there are about 1,500 per 100,000 workers, data again from the United States. And fatalities, there are about 10 per 100,000 workers. So it's a very significant problem in the United States. What are the risks? Well, falls, which is an example of that Casey had when he fell from his stilts and became paralyzed. So that's one of the big risks in terms of what risks lead to accidents and injuries. Second, struck by an object or a vehicle. Third, most frequent is electricity or things related to electricity, connections of power lines and so forth, and caught in between. So those are kind of the risks that can happen, the most prevalent risks. But they're also quite diverse. So you can't just go in and focus on a particular thing when you're trying to make changes in the workplace that are general and across the whole workplace. Size of the population at risk in the United States, it's around 10 million workers. The economic impact, the workers' comp costs annually are in the range of about $2.5 billion a year in US dollars. And the impact on people, the quality of life, are injury, illness, poor health due to the environment and to the lifestyle kinds of issues. And so we focus on both the workplace environment and on lifestyle kinds of issues because they both interact together. So this is the burden that led to the development of this consideration. This burden led to the development of this project. What's the need? Well, the need really is to change the environment to make the workplace a safe and healthy place to work. And so what we've been doing since about 2011 in the United States is focused on the concept of total worker health, which is really an evolution from sort of the standard occupational safety and health to encompass well-being. That's really the change that NIOSH recommended in 2011. It had begun as a program in work-life balance, and then as it expanded and grew, NIOSH began to recognize that it really needs to be part of the standard safety and health going on in the workplace. And so they renamed it, or essentially identified the title, Total Worker Health, copyrighted it, and that term relates to safety, health, and well-being. We focus on supervision to give supervisors the tools to address the safety problems they confront. And that's how we most frequently, at least I most frequently, address organizational change in the workplace to make the workplace a safer, healthier place to work, and one where worker well-being is considered important. And we also focus on lifestyle issues, or at least I do, that individuals have control over. So both working in the environment, in the workplace environment, to change that, to make it safe and healthy, and also to focus on lifestyle individuals or workers. Well, what was our theoretical approach? I'll just quickly mention it because many people think it's important in terms of thinking how the structure of the intervention has been developed. And so for supervisors, we particularly leaned on social support theory. We've found that increased supervisor support can result in improved physical health and job satisfaction in employees, and we have publications in that area, but we're just only one of many that have found this kind of a result. So that's why we use social support theory as kind of an underpinning. What about the training itself? What's the theory behind the training and education? And the training, supervisor training, was delivered on a platform based on behavioral education principles. For example, it is self-paced. There's interactivity in it. People have frequent tests, and they get feedback if they're correct on the answer they give to the multiple choice questions. And if they make a mistake, then they repeat the test question until it's missed, if it's missed, until they get it correct. And they basically have to go back and reread some of the information and then get back to the question again. So this is fairly powerful educational principles that have been effective in our hands. For employees, our education, I kind of distinguish it as education because it is presented in a more educational kind of format. And it was based on social learning theory, which posits that peer influences affect people's actions. So we brought people together in small groups for their education. An example is shown in the picture on the lower right, and a picture of people taking the computer-based training that use the behavioral education principles is shown on the higher picture, each from this study. We also supported the training and education for both supervisors and workers. We introduced practice to reinforce the principles in the training and education. For supervisors, to provide feedback and specific experiences and interactions with employees. And for the employees, practice in making choices that supported a healthy lifestyle and engaged the family so it carried over to home. Now, what's the setting that we're working in? And we've done work in a lot of different workplace settings, including some in construction. And we recognize certain unique things about construction that are different from other kinds of industry. And one of the most important things is that the construction workplace is dynamic. Most workers have to complete their training or education in their workplace location. So looking at the pictures, you see the kinds of locations they might be working in. If you look at the lower left, there's a person working up inside a building, and when we bring our activities, our training or education to them, they can't step off there. In this case, the guy's in stilts, walk down out of the building, go to a construction trailer where we can set up and do what we're doing. We need a format that will work in that setting, so it can happen that people, after they're sitting down after a lunch, for example, could take the education or the training. And if you look in the top right picture, you see something that sort of exemplifies the problems that we have in construction these days, and that is that in commercial construction in particular, there are multiple crafts working simultaneously. So each one has their materials and their power strung out and sort of in the way. So housekeeping is kind of a big issue. It's really easy to trip over things. So this is kind of the environment that we're working in that we have to be mindful of when we think of an intervention that we want to implement in construction. So we took these things into account because that workplace location can move day to day or even hour to hour within any construction site. So for the supervisors, our intervention, again, our route to organizational changes through the supervisors. So we used training that we did on a tablet, an iPad in this case, and a picture from one of the screens is shown on the right, one of the training screens from C-Train. And this is my conflict of interest. That's the training format we developed. Particularly, we developed in agriculture for people with limited education, but we've applied it in a variety of situations in different industries and with people who have virtually no education, have never been to school, up through people with advanced college degrees. So it's effective with those with low education, works well with others as well. So what we were doing was to teach supervisors to, first of all, interact with their employees frequently and include non-work topics. That is, for them when they're walking through the workplace and interacting with their employees, that they talk to them and do it frequently, and not just complain about what they're doing wrong, but instead talk about what they're doing right, and also to talk with them about their activities outside of work and so forth. And this is helpful for the supervisors to know, because they may know if problems are coming up in the person's life and they may need a little flexibility, or they may understand if they're a little distracted at times, which of course is very dangerous in a construction situation, and supervisors would want to be able to adjust to that whenever, if possible. So interacting with employees on a more frequent basis was something that we taught in the training, and to talk about non-work topics. And the second part, and the larger part, was to shape safe and healthy behaviors in their employees using social reinforcers. So as I mentioned before, oftentimes supervisors come out of the trades. They come because they're technical skills, not their supervisor skills. And it's really quite rare for people to have supervisor training, particularly in construction crafts and when people are below the manager level in organizations. And so we give this training then that they would otherwise get in such supervisor training in this training program. And the practice for the supervisors was, in this case, an app and it's called Habitrack. It is an enterprise app for our university, and we have basically given people on an iPhone or on an iPod Touch a program, an app, which allows them to log in how frequently they interact with employees and how frequent and the kinds of interactions that they have. And it takes about 5 minutes per day for them to enter the information into it, because they're basically just tapping on a place on the screen on the device. So that's for the supervisors. Now for everybody, for both supervisors and employees, we had training or education in developing healthy lifestyle behaviors. We used scripted training, and we conducted that in small groups. Here's an example of one of our scripted training cards, and each one was presented on a card like this. It's a double, sort of both front and back, and there is a leader card, which you see here, and then there's also a member card. And so each week, one person is chosen as the leader, and they read from this card to others that have the same information on their card, except they don't have the things that are in blue. So what's in red are really instructions and things that everybody sees, and they're questions asked intended to stimulate discussion about whatever the topic is, in this case, basic nutrition. The blue is only on the leader card, and those are the answers to the questions, so that the leader has answers, but at first, as they read the questions, people discuss and bring their knowledge and information to it and present that information. And so the members have a chance to discuss, and really a sort of a team activity begins to develop, where people suggest the things that they've learned and suggest things that have worked for them to each other. So that's how this scripted training works. And our lifestyle cards, as we call them, there were 12 of them, and the first one was the introduction to Get Healthier, which we call them the Get Healthier cards. And then there are the topics shown on the left-hand side of the screen. So these are lifestyle, primarily sleep, calories, liquids, snacks, exercise, strength training, flexibility, stress, and so forth. Of these are mostly wellness kinds of activity cards or information. Sleep goes a little bit beyond that. This was developed early on in the development of the concept of total worker health, which stressed wellness instead of well-being. So we focused on wellness because that's what we were expected to do. As we've evolved, we have more well-being topics that go beyond wellness extensively. Well, we also have practice along with the basic nutrition with each of these lifestyle cards. And so it takes about 30 minutes to get through the lifestyle card to have the discussion with a small group, 3 to 7 people, we recommend. And so afterwards, they are given a take-home activity tracking sheet, where we ask questions for them to do tasks to go and learn more about what they've learned from the card. And this helps bring it home, so they do it at home and they begin to bring their home into it, because one of the important factors or features or considerations of total worker health is that things don't stop at work. What happens at work affects home, and what happens at home affects work. So this brings the family into it when possible, and that can increase the value of what's being done. Now, in our study, we gave them a gift card when they brought back the answers to this card and brought it back at the next session. We did one of these a week. So we also gave survey measures before and after, and I put all the survey members on the screen. I'm not going to go through all of them because it was early in total worker health. We really wanted to look at a whole range of things, from biomonitoring kinds of things down at the bottom, like BMI, height and weight, grip strength and flexibility, up through lifestyle kinds of activities and mental health kinds of issues. So this, and as well as safety as well. So this whole range of questions were asked. These are all standardized questionnaires, with the exception of 1 or 2 that you could get from us if you were interested in those. And there are about 22 surveys, standardized surveys involved there, and about 245 questions, 7 markers, but they got through it in about 45 minutes. And if you, particularly the second time they took it, and we gave this before we started the training or the intervention, and then at the end of the intervention. And you see people actually taking, filling out these questionnaires, surveys at the present in the middle of the top picture, people sitting around at a table and on the left part of the picture. And over at the right, you see someone in a separate place where they weren't in front of others, where they were taking BMI, height, weight, and so forth, and blood pressure measures. So they were in a more private place, more confidential place. And if you look down in the lower right picture, you see we were using Survey Gizmo on this. And what we did was we paid Survey Gizmo to give large radio buttons. You see the circles, those are radio buttons. When we first started working with Survey Gizmo, the buttons were about the size of the dot in the middle of the first set of 5 answers on the top. Sort of the black surrounded by the dark blue is that sort of black point. So we got them to enlarge it. So because people's hands are just bigger than that, and so particularly people working in construction often have pretty big mitts, and so we got them to improve the so it would work the format so it would work better with people with larger hands. Well, that was the employee and supervisor training together, the lifestyle training, and supervisor training. This is kind of the flow of the study. We began with behavior, and we spent 2 weeks in that, and had them basically record how frequently they interacted with their employees each day. And again, it took about 5 minutes per day to complete this, not very long at all. And then we started the training on effective supervision and reinforcing appropriate behaviors. Took about 90 minutes for people to get through that with self-paced. So some people got through in less than an hour, some took a couple of hours, but on average about 90 minutes. This is sort of a picture of a screen from the training. And then the following 12 weeks, we asked them first to reinforce safety practices of their choosing. So pick a safety behavior or a safety practice that you'd like to see your employees implement. And it could be different for different employees, but just pick one and reliably reinforce it. And then later on, we asked them to now switch over and focus on reinforcing healthy lifestyle behaviors. I see you're brought in some fresh fruit for your snack instead of getting some chips from the cart. That's great. That's terrific. That's congratulations on doing that. So social kinds of reinforcers. And again, they were tracking and keeping track of how frequently they did those things and with that app. At the same time, and actually about the time that the effective supervision computer-based training was going on, we began with the work crew and the supervisors to get healthier education. Same set of cards that you saw before, begin with the surveys on topic 1, and then go on for the rest of the topics 2 through 11, and then the last topic at the end, and then again the surveys and the biomonitoring. So that's kind of the flow of the overall study that you can see in this slide. So what was our participant sample? We had 4 construction companies, 1 conducted in a relatively large town, Portland, Oregon, where I'm sitting now, 1 in a smaller town, and then 1 Eugene, and then in a rural area in Prineville. Each of them had construction projects and large commercial construction projects going on. The one in Prineville is really the data farms, sort of software, data, tracking farms and server farms, I should say. And that's what's being built in that lower picture out in the desert. So what kind of results did we have? Well, in the training and in both training and education, well, we had 25 supervisors who completed the training, and the knowledge increased significantly, and the effect size D was 2.92. Now, if you're familiar with effect sizes, which you may or may not be, effect sizes tells you how much of a change happened and taking into account the variability in the population. So it's a standardized improvement, measure of improvement. And when people have looked at a large number of studies, a small effect size starts around 0.2 up to 0.49. A medium effect size starts around 0.5 and goes up to 0.79, and then a large effect size starts at 0.80. This is 2.92. This is a off-the-charts kind of knowledge improvement. They really learned the information in the training that we gave them, and it's really among the largest that's really been published. So tracking or self-monitoring, how frequently were they doing the things that we were asking them to do? Well, at the beginning, we asked them, if you look at the red box, to identify how frequently they would make comments to people. And the comments at first were the frequency of comments on their work, and those are the ones up at the top and the X's, and how frequently were they talking about interactions with their families. Those are the ones down around 40 to 60, averaging in the first 4 weeks. Then after those first 4 weeks, we asked them to switch over and begin reinforcing safety. So when they were reinforcing safety comments, what they were recording on the app was telling us that their self-recordings, again, took 5 minutes a day, is that they were doing a certain number of safety comments. There's a decline overall, which we find with this tracking app. It's kind of fun at first, and then becomes a little less exciting as time goes on. So, but you see that the safety comments are the black triangles, and the healthy lifestyle comments, reinforcing that, are the small squares with the cross-hatching lines going through it, from right to left or bottom to top. And so that shows that when we're asking them to reinforce safety, they in fact were reinforcing it more frequently than healthy lifestyle. Then we asked them to switch and start talking about healthy lifestyle. As we asked them to switch, that reversed, so that they're making more healthy lifestyle comments and less safety comments, but still making both of them, which of course is really quite appropriate. So this shows from our tracking app that they were doing what we asked them to do in the training. So then thinking about the scripted lifestyle education that was employed with the 22 supervisors and 13 employees, so the total of 35 people, there were knowledge increases for every topic, all 12 topics. And the effect sizes ranged from D equals 0.18. Remember, the small effect sizes started at 0.2, so this is a little bit less than small, but up to 1.59. So the effect size was actually large for many of the lifestyle knowledge cards. And reaction measures, we asked them, did you like it? And they rated the training as excellent and useful in 2 different ratings. So what about results at the end of the intervention? This is on 35 people, and we were looking for significant improvements. Almost all the improvements were positive. Those are the ones I'll talk about. Family supportive supervisor behaviors, one of the things we were training them to do. In fact, they did report that they were doing more of that, and the effect size 0.72. They also reported increased team cohesion. The frequency of exercising, 30 minutes per day was increased. Frequency of muscle toning exercise increased. Sugary snacks and drinks decreased. Those are the effect size, same effect size for each. Sleep duration increased about half an hour per week, which was had that effect size. They also had coworker healthy diet support, which you'd kind of expect would come out of those team sort of group meetings that they had, where they kind of supported each other. Well, they felt that they were getting more healthy diet support from their coworkers and also from their families. So that meant they were taking it home and getting support from their families. And we had we asked questions about that. They say, yeah, in fact, they were engaging their families in the activities. At least some of them anecdotally told us that. And finally, systolic blood pressure decreased. So we have social support up in the first couple of bullets. We have lifestyle kinds of activity improvements in the middle 4, and down at the bottom we have health, sort of more social support really, and then biomonitoring improvements. Most of the changes of the other measures were in a positive direction, but these are the significant ones. So if you look at, to sort of summarize overall the findings and measured against Kirkpatrick's fairly well-known evaluation of training, he has the 4 levels of training evaluation: reaction, knowledge, behavior, and results. Well, reaction is ratings. The ratings were good to excellent. Knowledge improved. There were substantial knowledge gains in supervisor training and in the Get Healthier cards. Behavior changed by self-report. They increased targeted comments to workers. The supervisors reported that. And they reported sleep duration changes and changes in exercise patterns and reduced sugary snacks and drinks. So those were behavioral changes that they reported in self-report. And these are standardized surveys, so we believe they are reliable in the information that they're providing. And what about in terms of results? The kinds of things we wanted to see impacts in the sort of the health or well-being status of people. And one was the systolic blood pressure improvement. It was a reduction, and also an increase in team cohesion, which is another thing we want to see happen. So, or taught and encouraged people to do. So from this evaluation, all 4 levels of Kirkpatrick's training evaluation, in fact, showed improvement. And it's very rare for trainings to be evaluated with all these kinds of measures. Usually they just look at reaction. Rarely do they look at knowledge. Even less frequently do they look at behavior, partly because it's expensive. And rarely do they look at, did it have an impact on something important to the well-being of the individual or of the company. But in fact, we found changes in each of these. So just a comment from one of the people that took the training, Louis Archiga from Inline Commercial Construction, one of our partners, said, "My communication with my subcontractor and coworkers has significantly increased, not only on the professional aspect, but personal as well." So this is just an example of, just sort of a comment that somebody made at the end of the whole program, the intervention program. So how does one access the intervention? Usually what happens at the end of a project is you publish it, which we've done with this. I'll show you the reference at the end, and then you move on to the next project. But we're working very hard at dissemination kind of activities. So we started asking ourselves, how do people access interventions to implement them in their workplace? How do people go about that? We did a review of the total worker health literature in 2014. That's published, and the reference is down at the bottom. And then in 2017, we completed a second review. That's coming out in a book from NIOSH. It says summer 2018. It ends up being spring 2019 that'll be published. But at any rate, we looked at these all these interventions that people had done in total worker health. And we looked for, was it available? Could we pick these things up and implement them ourselves, since they were essentially evidence-based training and education and other types of interventions? The answer was no, we couldn't. Some of the people had left the field, no one had sort of made their intervention available for people to use, particularly the 17 that we looked at in 2014. And we wrote the people we couldn't get in touch with. We tried emailing, we sent them letters, we didn't get a response back. The people we did get a response to, they said, that would be a good idea if we got it out there. So now when we got to 2017, we had begun working in this area, and we had some interventions that were available to people. So there's more, and by the time we hit 2017, there were some, by 2017, but still the numbers were really small. So we thought, how do we do this? How does one do this? And so does one take methods section from a publication and extrapolate from that, oh my gosh. Do you call the author and get their field research protocols? Well, my field research protocols are not fun to read. I can assure you that my research staff will mention that from time to time. And then do you tailor those methods for your unit or organization? Well, that's really asking too much. We thought, oh my God. So we developed standalone, we think, tools and toolkits, and B-Super, the project I'm talking about, is one of these. And I'll talk about a little bit about how you might get your hands on it if you are interested in it, or some of our other interventions from our Total Worker Health Center. Well, on our website, what you'll find is the basic answers to the questions that you would want to ask, or a manager would want to ask, why should I do this? And so you can see the questions there, and if you click the plus on our website, you can get to answers to these sort of basic questions. We also have a toolkit website you see on the left, and a tools website or web page on the right. And in our case, B-Super is the one that we're talking about here, and it is available in Spanish and English, and the Get Healthier Lifestyle cards also available in Spanish and English. So that's the material, or the materials and the training and so forth that you can get access to, but there also are user guides that you can get to help you use them that are not our research protocol, but sort of plain language, human language kind of description of how to go about conducting or implementing this intervention. We've also decided this isn't good enough. We needed something better, and so we've developed the Your Work Path website, where we have this information in a more user-friendly kind of location and easier to access. And so if you go to yourworkpath.com, you can find the B-Super program, as well as other intervention programs, and there are other interventions coming as well as some of the individual tools. And so I distinguish the Get Healthier Lifestyle Education cards, the one in the box in the top right table, as a tool because it's just the cards, whereas over on the left, it's the whole intervention, the supervisor training, the practice, and as well as the Get Healthier Lifestyle cards and the practice for that. So that's kind of on the left, that's the whole thing, and on the right is just one of the tools that someone might like to use, just that alone. So if you then go to yourworkpath.com, you'll see a more user-friendly, sort of easy to understand list of sort of each of the steps that would take place and that we make available to you. And we have an infographic that's been developed that you can show to your managers that you can find on Your Work Path. And you notice there's a dissemination liaison down at the bottom, Helen Shuckers, who along with others have helped develop these one-pagers to give you sort of a one-page story of what an intervention is about. And if you then follow that along, you can get to our B-Super page where you can find videos on sort of how to apply the intervention, how to implement the intervention. So we made it available as best we can in videos, and we're actually going to probably be improving those in the near future, in the near term. And over on the right, we also have the evaluation component. Now, the evaluation component adds about 10 or 15 minutes to everything. Each of the trainings, the individual employee trainings, as well as the trainings by the supervisors, we have the evaluation available, but it adds a lot of time to it. You may not want to use it, so we make that available as a separate component. The user guide.
I know you have about 5 minutes left. That'll take us into 2:45.
Okay, thank you very much. I'm just about on schedule for that. Amazingly so. So this is a picture of our current user guide that we're just now finalizing. You can see the topics on the left, and you can see what kind of people need to get to do the intervention on the right. And you can get everything from, I think, 4 clicks. You can click one time to download the vSuper toolkits and everything together in it. And you can click one more time to get the supervisor training, one more time, a third time to get the cards, the lifestyle cards, and then a fourth time to get sort of the user guide and things of that sort, or other things of that sort. So I think in 4 clicks you can get access to everything. There is a cost for the supervisor training and the guides, which was shown in one of the slides earlier, and the lifestyle, I should say, the lifestyle cards. And they were both shown earlier. They're not expensive. So the partners and authors for this project were the International Union of Painters and Allied Trades, and electrical workers were the 2 union partners, and then the construction partners are shown. The authors are shown. The reference is shown to where you can get the reference for the information I've presented up until now. So then we said, okay, let's move it over to agriculture. So we took the same intervention and we went into some of our partners in vineyards, and we sat down with a group of workers in agriculture and said, okay, tell us, in sort of focus group approach, tell us what kind of education cards you would like in addition to the Get Healthier cards, which are primarily wellness kinds of cards. And so we called them the well-being cards, and those are shown on the bottom of the panel in the middle. And so those are the topics that, based on both talking with managers and talking with the workers, we found that people were interested in. So we then took that, we created all those cards, translated them in Spanish, so we've got them all in English and in Spanish, and these will all be available starting in 2019 by the first of the year. And we took the training, the supervisor training, and the pictures on the well-being cards, and we put in pictures from agriculture, from vineyards, because those were the people that we were working with. So, changed a little bit on the examples, but primarily changed pictures, and we also added some videos that we had from a previous training of people interacting with each other on how to be a good supervisor. So how did this project differ? We've done a pilot study with this. The only difference is that at the top right where it says 28 weeks, if they did all of those topics, it would take them 28 weeks. Now, we don't, people can do as many as they want and make it as long as they want. And so because harvest came up in our project, we had to shorten this considerably. But anyway, everything else was otherwise the same. And it really is optional how many cards you want to do, how many topics you want to do. So what's different in ag? It took longer training because the supervisors had less education. There were less education in the employee and the lifestyle card, so they paired up. One would help the other read through the card in the topic. And we didn't get to as many of the well-being topics because they chose to move, they had harvest come up. What's the same in ag? The enthusiasm for the program, maybe even a little bit higher. They loved it. They really loved the lifestyle cards and the well-being cards. And there were actually more positive changes in the lifestyle survey results. And these are the positive changes that were there. And I'm not going to go over them. So do we have replication or common findings? What did it take to make the changes? And so essentially, as I said, we put in the movies, we had to put in different pictures of agriculture instead of construction. And in fact, we found that the findings were similar. There were common findings. To say it's a replication is a little bit strong, but we did find comparable findings in the other project in agriculture. And it's a small group. It's only 10 people we did the pilot with in one vineyard. And that's the end of the webinar. So, Catherine, thank you very much.
Thank you, Kent. Can you hear me all right, first of all?
Yes, I can.
Okay, perfect. So we've got some questions here, and I'm just going to start to go through them for you.
Okay.
Is this training, in fact, something that was provided on an ongoing basis, or was it a one-off for the companies you worked with?
It was a one-off. It was a one-off, and however, the tracking essentially extended that for about 12 weeks. The tracking was the practice application. So, as might be implied by the question, we knew that if we just did one-off training, that it would come and go really pretty quickly. So, how do we have that continue? So, we use self-monitoring or a tracking app that, and self-monitoring is a concept in psychology that it has been tested out, and it's been found that the feedback that comes out of tracking changes behavior and changes it significantly, and that we believe was the case here. So it essentially each day that I'm saying, did I talk with the employees? Did I reinforce this? Did I reinforce safety? Did I reinforce healthy behaviors? So it really extended on for that longer period of time.
Thank you, Kent. Now, you did mention that you did try and do some follow-up, I believe, and one of the questions was directly related to follow-up. Was there any follow-up with the research with the different organizations to see if the program continued with success?
So that's a good question. We did not have the funding to do that. So even though they were willing for us to come back and repeat the tests at a later time, the funding for that project was really pretty small, and we did not have the funding to do it. So the answer is they were willing for us to come back and continue doing testing, doing the surveys, so forth. However, as far as the training and education was concerned, it ended at the end of the 12 weeks.
Curious, another question. Do you know what the download rate of the Super Kit was, and in fact, how popular it is?
So that's a really good question. We have put it up there fairly recently, and we have not yet had any downloads of the Super. Either that or either the supervisor training or the lifestyle cards. We've just started our Your Work Path website, and we're just reaching out to companies to encourage them. And we felt that where it was sitting on the university website, nobody would find it. And so that's why we started this Your Work Path website, and we started podcasts, and we have a blog and so forth, and to drive traffic to it. So right now we really don't have any downloads of it, but we also have significantly amped up the dissemination process and outreach on both the tools and the toolkits. We do have some tools that we've had for a longer period of time that have had quite a few downloads, like around 1,000 to 1,500 a year on our most popular one, but not on these yet.
Thanks, Kent. Now, you did comment on how excited the workers were in both research projects. And you talked about the gift card as being reinforcement to bring homework back. Did you find that this was critical to have some kind of reinforcement to make the training a success?
So that's a really good question and a really hard one to answer because we didn't try it without the gift cards. However, the supervisor training did not depend on the gift cards. The supervisor training was sort of reinforced by the feedback with the app later on, and the survey showed a change. The lifestyle training, about 75% of the people would bring back in the construction project, would bring back the filled in practice sheet, and we'd look at this because that was kind of a qualitative kind of thing. They had to do some work and write out answers and so forth, and you could do it you could do a lot or you can do a little, and they mostly did more than a little, but not a lot. They appear obviously were responding to the questions and so forth, and so that seemed to be effective, and they got their gift cards, and they certainly didn't walk away without their gift cards. So I would think that was important. With our agricultural group, everybody took the home and brought back the practice sheets and got their gift cards. The gift cards were for that they could exchange at local stores for groceries and stuff like that. So it could have been a kind of a useful supplement to people. Now, if they were the enthusiasm was seen in the group when they were sitting around talking about these lifestyle topics and cards, and so and that did not wane, and it was the enthusiasm was there even with the people who didn't take home the homework, essentially the practice. The enthusiasm was over the process, I think, over the information on the cards and the ability to talk it over with their crew, other members of their crew, their work group. And I'm quite confident that if we'd had no practice and no cards, that would have gone on. The practice should have been helpful in a variety of ways, and so I kind of doubt they'd have done that without the practice part of it, taking home the information.
Thanks, Kent. So you
but I'm sure some of them
about,
were, and it was clear this is important to them.
You've definitely talked about the participation level being really, really high for the employees. How did you get organizational buy-in at the beginning? Because they had to free up staff, and ostensibly this would have cost them money. So how did you get that off the ground?
Yeah, it's a really good question. It was the hardest part. When you work with private companies, there is a real focus on the cost and the bottom line and so forth. And so I just talked to a lot of companies about it. And what I emphasized was you'll end up with better supervisors and you'll end up with a happier workforce if the training is effective. And of course, we'd used similar training in other settings, so we knew that it was right. Whether or not our implementation would be effective, we didn't know, but we thought it would be. And so that seemed to be a sales point. And then the fact that people would learn lifestyle information was, you could tell that the managers thought that's really important. And particularly in when we moved into the vineyards, they thought that was really important for their workforce. And the vineyards were more small businesses where there was more focus on the employees. The construction groups were larger companies, and there was a clear interest in employees, but it was in the agricultural areas almost like a family. So I would say supervisor training that people will learn from will become better supervisors. The workers will be happier because the supervisors will be reinforcing good stuff instead of just complaining about bad stuff, and supportive of what their needs are, and the lifestyle, because even though the lifestyle cards seem like basic information we all should have learned in like elementary school or high school, it was like news to them. So much of it was that they just didn't know that stuff. So people have just lost that, and maybe that's why we're all a little heavier than we might have been a few decades ago.
Time for one more question. So the last question, were other factors considered when assessing physiological changes such as systolic blood pressure, change in activity routine, change in work demands?
So we were particularly interested in driving down the risk factors that led to chronic diseases, late life chronic diseases like obesity and heart problems and things of that sort. So that is what we focused on. So we focused on measures that would tell us about a little bit about that in our biomonitoring and also in our surveys. So those were really the driving factors in our selection of measures that we had, and also we were interested in stress. We had stress-related measures with this reduced stress.
Thank you, Kent. Wonderful conversation. I can't wait to take this to some of my colleagues for them to apply it in their healthcare world. I think you've shown us a program that is highly adaptable and has proven itself to have some very positive implications for positive change. Thank you very much, and thank you to all of our participants today, and please watch for the survey and the slide deck that Kent has presented today. Have a great day, everyone. Thank you for joining us.
Thank you.